People, me just come to make that video, yeah. I know I have to make this video. I know I have to make this video. As you can see, me in my bed. Me in my bed because me have back pain, me back sick from how much weeks now, but since this week, yeah, it just take its toll upon me. Guys, I don't ever think to say, care work hard are easy? Wanna think, what is your thought on care work? Do you think it's easy or it's hard? Well, let me tell you something. I want tough job. Let me tell you something. I want tough job. You basically, especially if you are working in nursing or dementia care, you basically have to do everything for these people. You basically have to do everything for these people. You have to support them with everything from their food, their personal care, take them from place to place. You have to do everything for them. And you don't get recognized. Imagine you have some residents who are big people. 300 pounds, 350 pounds, 250 pounds. And you have to use full body hoist on them people. Even with the hoist, it's hard. Because you have to push them and pull them. You don't just put them on the hoist and they move. You have to push them and pull them. You have to push the hoist and pull the hoist. Even if they put on wheel, you have to push it. And it literally takes its toll on your joints and on your muscles and on your back. And you know the worst part of it. You know the worst part of it. Them themselves, your client them or your resident them, they're rude to you. They look down on you. The things that they say to you, it's unbelievable. But you don't say nothing because you know them have dementia or so on and so forth. But you see the relative them, rude some of them. Some of them, they don't even acknowledge you. You're not good enough for them to even acknowledge you. They walk past you. You sit down here so, and then walk past. Then can't even say good morning or good afternoon. Then just walk past you and gone to their family member. You have friends coming, they can look for their friends. And then walk past, then don't even acknowledge, they don't see you. You have doctors, and I am saying doctors, who work with these residents. And you sit down there so and then come. You know, one time in my day at work, there was a doctor. And that doctor come and she never talked to none of the carers. She gone and talk to the nurse because it's our colleagues, right? We are not they are colleagues. And she will walk up there so and she will look for, she go up at the office and she go up there and she don't see the nurse and she come back. They come ask, have you seen so and so? No, ask me because I not answer you. And after some time, I think other staff, colleagues, some of my colleagues, them starting to realize that this doctor, this specific doctor, she no look upon people. She's too proud. One day she go up at the office, she go look for somebody. She go look for the nurse and she come back and she not see the nurse. She come back. She not better come ask somebody nothing. She just walk around and look for the nurse until she find the nurse. So me tell you, you have nurses who you work with, who because they don't do, and look at nurses, they do dirty job because they have to dress people wound and something. But because they don't clean pool and they don't wash residents and they don't do this and don't do that, they look upon you differently. Understand me? The nurses are not so bad like the doctors and the family member. They don't look upon you and say, you know what? Let us cherish these people because these people they play our role. They especially you come at the home and you look and you see your relative them in a good health and look good and always clean and looking nice. You can't even acknowledge that. You come and you see your family them look good and you say, boy, me have to really thank them people here. And they might say to you, say, oh, I really thank you for the job that you're doing that you've done with my mom or my dad or my grandpa or my grandma. And they will give you that plastic smile. Thank you so much, guys. You're doing wonderful job, condescending. You're doing wonderful job. But my God, just put 1 foot wrong. We didn't think you put 1 foot wrong. Them never fail to report you. Them no stop. Then go straight to the head. And at them same one they can't give you the plastic smile. So that's why I know say they don't acknowledge you. But people, let me tell you, this job is hard as hell. Right now, may I tell you say, my back is giving me hell. For the past 4 weeks or so, my back, I play up. But may I tell you, since Monday, may I tell you, so I feel some pain in my back. Understand me? Right now, me I have to go see the physiotherapist on Wednesday coming. I saw the osteopath yesterday. And me have the doctor for see as well. Me have to go do the man tell me yesterday, say me have to go do some real good work on my back and me have to rest my back. Let me tell you something. Your joints ache. Your muscles ache. And I'm telling you, I'm thinking, I pray to God that by the time my back heal to the point where I can go back to work, then I can find something else. Because your back is something will never get better. And it worries me. Right now, me feel helpless. Me lay down in a bed. Me get up like me old. Me walk like me old because my back. Right now, see the way me lay down, me have to arch my back so me can get some comfort. You understand me? It's not easy. Care work not easy. And nobody, not even the government, don't acknowledge you as a carer. Nobody acknowledge you because who are you? You're nobody really. You're just a mere shit cleaner. Why should we acknowledge you? Look upon here and say, these people spend their time irrespective that we are getting pay. And what we are getting pay as well, peanut. Because the work what we do and the pay what we get, it's peanut. If they acknowledge you, they get more pay. But the money is good, but it's not even all about the money. It's the fact that nobody no look upon you as like you're nobody. And just look down their nose upon you. All for what? For nothing at all. Me figure it up, go broke my back and mess up myself. I've done this job now for 10 years and I do not think that I want to spend another year in there. I'm praying to God. Me have a job, but I'm praying to God that by the time my back heal to the point where I can go back to work, I don't want to go back to care. If I have a choice right now, I wouldn't go back to care. I cannot do this much longer. I'm older now, and my body is not the way it used to be. And it's not easy. At this age, me can't do care work. Because care work not easy. Care work, look, a whole heap of walking you have to do, Because when they ring the bell there, you have to do a lot of walking, a lot of bending, a lot of maneuvering in a care work. It's not easy because you have to do everything for these people. Everything. They're like our little children. Them. When you have a little picnic, when you have to do everything for them, it means everything. If they want to go to the toilet, you have to do it. If they want to eat, you have to feed them. You have to do everything for them. It's not easy. At this point, me I feel in a bed Like the osteopath said to me yesterday, even walking, me have to, he's advising me to walk slowly. He's advising me to take rest. He's advising me to not do anything. No lift anything. That's his advice. And it kind of make you feel scared. It's kind of scary. And it make you wonder. Because you see people who has gone through, who was done this job, or who was suffered from back pain where they have to do surgery and all them things. And it make you wonder, I said, am I gonna get there? It's hard. It's hard. It's hard. I tell you. Anyways, guys, show some love pan the Donna British here. She's here in bed sick with back pain. Bless upon herself. All the best. Remember to like, comment, share, subscribe, and have a beautiful weekend. One love, one heart. Let's get together and feel alright. Peace out. Bless upon yourself. Mwah. Bye.